Hi guys, I wanted to make a separate video for DKA treatment, and that's because it's something that comes up on a lot of tests, and it definitely will come up when you're prepping for the NCLEX, and it's a super quick answer. So I just wanted to have this ready for those of you who are looking for a quick, easy answer to this question. When we talk about the management or treatment of DKA, we have to think about all the different things that are going on in the body. If you look back up here at this mess of a visual that I went through in the last video, you see that there's all these different kinds of pathways or things that are happening. You've got nausea and vomiting from acidosis, you've got polyuria, polydipsia, you've got severe dehydration, and of course you have an increase, very high blood glucose levels. So where do we start? What do we treat first? This question comes up in, I can't even count how many times I've been doing NCLEX prep with somebody and this has come up and they've gotten it wrong. I would say almost 90% of the time people get this wrong the first time through. And that's because it's a little bit counterintuitive. So of course, as usual, the first thing we're going to worry about are ABCs. Don't miss this on a test question, guys. Don't be so focused on the patho and on what you've learned that you forget the basics. We still have to prioritize. We still have to think like RNs. We still have to know when to call a physician, or when to perform this intervention or that intervention. That aspect of prioritization is incredibly important, and I feel like sometimes it gets lost in all of this information. So just remember, ABCs. It's so logical, right? Don't forget ABCs. So if the patient comes in and for everything that's going on, they're not breathing, then absolutely, or they're not breathing well, or what have you, absolutely it's okay to administer oxygen first, okay? But now we've got our ABCs out of the way. We've got a dehydrated patient, hyperglycemic patient. What are we going to deal with first? And this is where people's mistake happens. Because DKA is caused by or is related so much to hyperglycemia, people think we have to treat that hyperglycemia first. But the more severe problem in the moment is actually hypovolemia or dehydration. This is the thing that is going to cause the most damage the most quickly. So before we deal with the hyperglycemia, the first thing we're going to do is fluids. We're going to do normal saline. We can do a hypotonic if we want to try to get some of the fluid back into the cells. Again, though, we need to watch out for that drop in potassium. And so we're going to, again, fluids first. We're going to take care of that dehydration before we do anything else. And this is one of those things that you can do in the ER. You just do that very quickly, get them started on fluids before you do anything else. The second step then, if we're not kind of counting ABCs as the first, the second thing we're going to do then is the IV insulin. We're going to use regular insulin. We're going to give the bolus first, and obviously that's ordered by a physician, and then we're going to do a continuous infusion. You don't need to know specifics about how much, how long for your test, for your NCLEX. You just need to understand, really the main thing you need to understand is that we're treating the fluids first, then the insulin comes. After that, we're going to look at the potassium. We're going to take care of the hypovolemia that will likely occur. So this is a case where if the patient's potassium is less than 5, which is actually, is less than 5, which is actually normal, right? 3.5 to 5 is normal. But even if it's somewhere in that window and it's less than 5, we're going to get ready to administer that potassium. And then after the potassium, that's when we're going to start dealing with the acidosis. And we're going to start administering bicarb. And that obviously is going to depend on where the patient's pH is. Okay, so when you're looking at a test question about the emergency management or treatment of diabetic ketoacidosis, I just want you to think about all the things that are wrong, right? You've got dehydration, you've got hyperglycemia, you've got hypokalemia, and then you've got metabolic acidosis. And just remember that this is the order that we're treating in. Dehydration first, then hyperglycemia, then hypokalemia, then metabolic acidosis. And so in real life, yes, a lot of this stuff is being done at the same time. And I know that that's one of the hard things about exams. What they're really asking you is, what's the priority? What's the most important thing? In real life, I'm doing this, well, another nurse is doing this, and oftentimes someone else is drawing this up because it's a real bugger to draw. So, you've got things going on all at the same time. Unfortunately, in exams, it's hard to depict that. So again, go with this, okay? And it's going to be the same thing with HHS, but I'll let you check that video on its own. And then, just so that we know, when we're doing managing diabetic ketoacidosis, so we've dealt with kind of all of these emergent things. The patient is they've got IVs in running, fluids, they've got insulin running, they've got potassium chloride, and they've got some bicarb. What are we going to do? We have to continue to monitor that patient. And so that's where it's kind of that blood work that I said earlier. We're going to be doing blood work constantly. It's just a constant thing. It feels like the blood work comes back, you're dealing with the results of the blood work, and by the time you're done that, you have more blood work that you have to look at and deal with again. It just keeps coming. So ongoing blood work. And then, of course, you're going to look at vitals. Of course, level of consciousness is incredibly important because of that acidosis. We don't want the patient going into a coma. We're going to keep an eye on their cardiac rhythm. And why is that? Because of the changes in potassium levels, right? And there's a lot more information on that I think in the videos on fluid and electrolytes. We're going to continually be monitoring their oxygen saturation. Most likely we'll be monitoring their CO2 as well. Something we're going to do as part of this kind of original treatment plan, you're going to drop a couple of IV lines. You're going to start a catheter you're going to put in a catheter as well, because you're going to be measuring ins and outs for a while. And then remember that whenever we are giving fluids, we want to be constantly assessing for fluid volume overload. So it might seem counterintuitive to see on an exam when a patient is suffering from dehydration that you are listening to their lung sounds for signs of fluid volume overload. But it's because we're watching out for side effects of the treatment that we are giving them. We want to make sure we're not overdoing it, right? And that's that. This is the test answer for how we manage DKA. The order is the most important thing, and then kind of understanding why we would be doing each one of those things, which you should understand from watching the video on DKA.